Welcome back to Soulsonneta, where we explore crucial health topics. Today, in the series of 10 most common health issues, we're delving into the realm of respiratory diseases, a group of conditions affecting the lungs and breathing. Knowledge about these diseases can empower you to protect your lung health. Let's get started. Before we proceed, remember that this content is intended for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider for personalized guidance on your health and medical conditions. Let's get started. Respiratory diseases encompass a wide range of conditions. Understanding them is key to early detection and management. Types of respiratory diseases. 1. Asthma. Asthma is a chronic condition characterized by inflammation of the airways, leading to recurring episodes of wheezing, breathlessness, chest tightness, and coughing, especially at night or early in the morning. Symptoms may vary in severity and frequency. Causes. Asthma can be triggered by allergens, e.g., pollen, dust mites, pet dander, respiratory infections, air pollution, smoking, and genetics. It often starts in childhood but can affect individuals of all ages. 2. Chronic obstructive pulmonary disease, COPD. Characteristics. COPD is a progressive lung disease that includes two main conditions: chronic bronchitis, chronic inflammation of the airways, and emphysema, damage to the lung tissue, reducing its elasticity. Symptoms include chronic cough, excessive mucus production, shortness of breath, and fatigue. Causes. Smoking is the primary cause of COPD. Long-term exposure to lung irritants like air pollution, secondhand smoke, and occupational dust or chemicals can also contribute. 3. Lung cancer. Unique characteristics. Lung cancer is characterized by the uncontrolled growth of abnormal cells in the lungs. It can present as a persistent cough, chest pain, coughing up blood, and unintentional weight loss. Causes. The leading cause of lung cancer is smoking, both active and passive, secondhand smoke. Other risk factors include exposure to radon gas, asbestos, occupational carcinogens, and a family history of lung cancer. 4. Pneumonia. Characteristics. Pneumonia is an infection that inflames the air sacs in one or both lungs. Symptoms include fever, chills, productive cough, shortness of breath, and chest pain. Causes. Pneumonia can be caused by various pathogens, including bacteria, viruses, and fungi. Streptococcus pneumoniae is a common bacterial cause. Viral pneumonia, often due to influenza, flu, viruses, is also prevalent. 5. Tuberculosis, TB. Unique characteristics. Tuberculosis is a bacterial infection primarily affecting the lungs. Symptoms include a persistent cough, night sweats, weight loss, fatigue, and coughing up blood, hemoptysis. Causes. TB is caused by Mycobacterium tuberculosis and spreads through airborne transmission. Factors like close contact with an infected person, weak immune systems, and inadequate treatment contribute to its spread. 6. Pulmonary fibrosis. Unique characteristics. Pulmonary fibrosis is characterized by the scarring of lung tissue, making it stiff and less able to expand. This leads to progressive difficulty in breathing. Symptoms include persistent dry cough, fatigue, and unexplained weight loss. Causes. In many cases, the cause is unknown, idiopathic pulmonary fibrosis. However, it can result from exposure to environmental toxins, certain medications, and autoimmune diseases. 7. Cystic fibrosis. Characteristics. Cystic fibrosis is a genetic disorder that causes thick and sticky mucus to accumulate in the lungs and other organs. Symptoms include chronic cough, recurrent lung infections, and difficulty breathing. Causes. Cystic fibrosis is caused by mutations in the CFTR gene. It is inherited and typically diagnosed in childhood. Understanding the unique characteristics and causes of these respiratory diseases is crucial for early diagnosis and effective management. If you or someone you know experiences symptoms associated with these conditions, seeking medical advice is essential for proper evaluation and treatment. Common symptoms of most respiratory diseases include shortness of breath, coughing, chest pain, fatigue, and wheezing. Seek medical attention if you experience these. Prevention of respiratory diseases. Let's explore diets, herbs, and spices that may help in preventing respiratory diseases. 1. Diet for respiratory disease prevention. Fruits and vegetables. A diet rich in fruits and vegetables provides essential vitamins, like vitamin C, and antioxidants that support lung health. These foods help reduce inflammation and protect against respiratory infections. Berries, citrus fruits, and leafy greens are excellent choices. Omega-3 fatty acids. Found in fatty fish like salmon and walnuts, omega-3 fatty acids have anti-inflammatory properties that can benefit lung function. They may reduce the risk of chronic respiratory conditions. Antioxidant-rich foods. Foods high in antioxidants, such as berries, nuts, and dark chocolate, help combat oxidative stress in the lungs, which is associated with respiratory diseases. Garlic and onions. These contain allicin, which has anti-inflammatory and antimicrobial properties. They may help reduce the risk of respiratory infections. Ginger and turmeric. Both spices have anti-inflammatory properties and may assist in reducing lung inflammation. Incorporating them into your diet can be beneficial. Green tea. Rich in antioxidants, green tea may have protective effects on the respiratory system. It can help reduce the risk of chronic respiratory diseases. Lean proteins. Include lean protein sources like poultry, fish, tofu, and legumes in your diet. Protein is essential for maintaining respiratory muscles. Healthy fats. Monounsaturated and polyunsaturated fats found in olive oil, avocados, and nuts can help reduce inflammation and support lung health. 2. Herbs and spices for respiratory health. Turmeric. Curcumin, the active compound in turmeric, has anti-inflammatory and antioxidant properties. It may help reduce inflammation in the airways and improve lung function. Ginger. Gingerol, found in ginger, has anti-inflammatory and antimicrobial effects. It may assist in reducing symptoms of respiratory infections. Garlic. Allicin in garlic has potential benefits for lung health, including reducing inflammation and lowering the risk of respiratory infections. Thyme. Thyme contains compounds like thymol, which can help relax the muscles in the respiratory tract, making it easier to breathe. Oregano. Oregano has antibacterial and anti-inflammatory properties, which may help prevent respiratory infections. Licorice root. Licorice root has been used traditionally for respiratory issues. It may help soothe the airways and reduce inflammation. 3. Hydration. Water and herbal teas. Staying well hydrated with water and herbal teas helps maintain the moisture levels in your respiratory tract. This can aid in mucus clearance and prevent respiratory discomfort. 4. Foods to avoid. Processed foods. Reduce consumption of processed foods, which often contain additives and preservatives that can exacerbate inflammation. Excessive sugar. High sugar intake can contribute to inflammation. Limit sugary snacks and beverages. Trans fats. Avoid trans fats found in fried and processed foods, as they can promote inflammation. 5. Maintaining a healthy lifestyle. Exercise regularly. Physical activity supports lung function and overall health. It helps improve lung capacity and circulation. Avoid smoking and secondhand smoke. Smoking is a major risk factor for respiratory diseases. If you smoke, quitting is the best step you can take to protect your lungs. Manage allergies. If you have allergies, work with a healthcare provider to manage them effectively to reduce the risk of respiratory symptoms. Remember that a balanced diet, regular exercise, and avoiding tobacco smoke are fundamental in preventing respiratory diseases. While these dietary choices, herbs, and spices can contribute to respiratory health, they should complement an overall healthy lifestyle. Always consult with a healthcare professional before making significant dietary changes, especially if you have underlying health conditions or are taking medications. Management strategies to most respiratory diseases include: 1. Medications. Depending on the condition, medications like bronchodilators, steroids, or antibiotics may be prescribed. Pulmonary rehabilitation. These programs provide exercise, education, and support for individuals with chronic lung conditions. 2. Surgery. In cases like lung cancer, surgical removal of tumors or lung transplantation may be necessary. Support and coping. Living with a respiratory disease can be challenging. Seek support from healthcare providers, support groups, and loved ones. Mental health and emotional well-being are essential aspects of managing these conditions. Thank you for joining us on this exploration of respiratory diseases in the series of the 10 most common health conditions. Knowledge and early detection are your allies. Stay informed and take care of your lungs. Don't forget to subscribe, hit that notification bell, and join us on our journey to empower you with health knowledge. Until next time, take deep breaths and stay well. This is Soulsonneta, signing off. At Soulsonneta, all we need is your well-being. So, we also drop soul-inspiring videos on practical poems and their respective applications to our daily endeavors from time to time. See you in the next episode of this series, where we shall be discussing mental disorders, meaning, types, causes, prevention and management techniques.